So we're here today for our September PCA lecture with Dr. Richard Carlton. Dr. Carlton I've known forever, or at least since I was a grown-up. And he is from New York, and he's a psychiatrist who studies lots of things. But one of the things he studies is medical marijuana. So we'll hear from him today to talk about medical marijuana and what is known about its effects on the brain and dementia. So Dr. Carlton, good morning, and thank you so much for being here.
Great pleasure. Now, Jane, is there a mechanism for me to show my screen?
Yes, you can just do share screen at the bottom. Do you see where it says?
Yep.
You want to see any? I don't. You want to see any of this, or?
And now, it says share screen. So let me get up the first document. There's no document of mine up yet. That's why you're seeing blank.
Okay. We're fine. We're good.
Okay. So I'm going to go to slideshow. Okay. We have an hour, including questions and answers. Okay. So this is really in two parts. The first is really about cannabis, to understand it and see where it fits in with dementia. And the others, I wanted to share some more general observations on how I and several other physicians around the country are actively treating dementia, bringing people back from oblivion. And the cannabis is one part of that. The others aren't using it, as far as I know. But there's nutrients, coconut oil, things that you may have heard of that are really, really effective, at least for some people. So do you all see my slide there?
Mm-hmm.
Okay. On the left is this picture of this girl, Jenna. She has seizures, 50 to 100 a day. She had to wear a football helmet because she was falling down all the time. They weren't grand mal seizures, they were head drops. And although she's 14, she was in kindergarten, literally in kindergarten. And you see how depressed and mopey she is. She's had 2 brain surgeries and vagal nerve stimulator. And she's on 4 anticonvulsants, 30 have been tried so far. And this is her life. And on the right, you see, after about 3 months on cannabis. Very low THC, it's mostly a CBD strain of cannabis. I'll tell you later on what CBD means. And you see how she's smiling and beaming. Her seizures have gone down from 50 to 100 a day to maybe 1 every 8 days. And she's off the anticonvulsants. So her brain is alert, her mind is alert, she's active. And the mom used to have to blow dry her hair because she was so lethargic. After shower, mom blow dried her hair. Now the girl says, "Mom, you don't have to blow dry my hair." So the mom says to me, "I have a 14-year-old girl, finally." And she says things like, "Please call my grandma, I want to talk to her." So she's initiating things. So that's in my own practice and my own experience. This next slide is not in my own practice, but this is a patient of another physician. There's a 14-month-old boy with an optic glioma. And on the left-hand side, this is the side of the head, and this is from the front. And you see this white blob here? It's about the size of an apricot. It's a tumor, an optic glioma, related to what just killed John McCain. And it's been growing despite the fact that he's in the hospital getting radiation therapy and chemotherapy. Growing so massively, they just had to release him to go home and die with hospice. Godspeed. There's nothing more they can do for him. Luckily, they were living in California, and cannabis was available legally, so they got him a high CBD strain, cannabidiol, not too much THC. They put it in his pacifier. It just sucks the pacifier 3-4 times a day. Look what happens to this massive tumor. Shrinks, gone. Shrinks, gone. That's 16 months. So this boy, who would have been dead within days of discharge, is alive and well. thanks to this stupid little herb, you know, that it's a weed that grows in meadows. So what's the cannabis doing? What is it affecting? How can it affect so many things, like stopping seizures, curing tumors? What is it? So we have receptors in the body, all over the body, not just in the nervous system, but you see here, the brain, fat tissue, muscle, liver, GI tract, pancreas, all these organs have receptors. Most of them are called CB1 receptors, or cannabinoid 1. But the cells of the immune system, the white blood cells, also have a cannabinoid receptor called CB2. And these are receptors for stuff that we make ourselves, the endocannabinoid systems. The names of the drugs, the chemicals that we make are not important, but it's the equivalent of neurotransmitters that we make, like dopamine and serotonin. But it just so happens that that plant, cannabis, has chemicals, we call them phytocannabinoids, phyto for plant, that hit these receptors in our organs and in our white blood cells. Now, if you hit a receptor in these organs, you can have a direct effect on the organ itself. Like, for example, in the GI tract, stimulating these CB1 receptors will take care of GERD and ulcerative colitis. So inflammatory bowel disease is very easily treated with THC, you know, cannabis. But this is a really interesting approach to things. These white blood cells circulate through the entire body, including the brain. So if they're inflamed, if the white blood cells are activated, releasing inflammatory mediators like tumor necrosis factor alpha, interleukin 1, it's inflaming the whole body. In a book that I'm writing on this subject, I came up with a vision that using the cannabinoids, the phytochemicals from the plant, it's like smoking a beehive. So you get the angry white blood cells to calm down and stop pumping out all the inflammatory stuff. So arthritis calms down, dementia calms down, a whole bunch of diseases that are of inflammatory nature will calm down because you're giving these phytochemicals. I want to talk for a moment about safety. What's really important for you to know is that while there are cannabis receptors all over the brain, you see these red and orange areas here, that's very high density. It's especially present in the parts of the brain that regulate movement and affect. But they're absent from the brainstem, in particular the part of the brainstem that controls heart rate and breathing. So the respiration drive is in the midbrain here, and the heart drive is right here. No cannabis CB1 receptors. So if you have an overdose of cannabis, or somebody, you know, smokes too many joints or eats too many brownies, you can get side effects. You could hallucinate, you could have a panic attack, you could vomit, but you won't die from respiratory failure or cardiac failure, unlike the opiates. A lot of opiate receptors in this part of the brain. That's why the most common cause of death from opiate overdose is respiratory failure and cardiac failure. They just stop breathing from the fentanyl and other things that they're taking too much of. By the way, in other parts of the brainstem, there are CB1 receptors, like the parts of the brainstem that control nausea and vomiting. And that's why cannabis is so good for controlling the nausea and vomiting of cancer chemotherapy and HIV/AIDS chemotherapy. So what's in the plant? You see the dashed line here is dividing the psychoactive stuff, which is tetrahydrocannabinol, THC. That's what gets people stoned, high, mood elevated, hungry, the munchies. So that's psychoactive. The rest of the plant has about 80 other cannabinoids, such as CBD, cannabidiol. That's a very important part of the story. CBD, CBG, terpenes, sesquiterpenes, etc. These are non-psychoactive, anti-inflammatory, antioxidant, and neuroreparative. I mean, I didn't know until reading about the cannabinoids that the neurons have a system for repairing themselves. Who knew? But they do. And these cannabinoids can get neurons to repair themselves. There's something that's very important you should know about called an entourage effect. So that all of these compounds collectively influence the THC. THC itself is not a very good drug. It's very potent and very disturbing, very difficult. The pure version of it is called dronabinol. It's available as a prescription. And people who take it are miserable. They're stoned and uncomfortable and anxious. And a lot of people don't want it. It's not a pleasant high. What makes the high pleasant is these other cannabinoids and terpenes. Terpenes are the aromatic compounds that you smell, for example, when you cut into a lime or in cloves. Those nice aromatic compounds that volatilize. They're very active in influencing the high from the THC. That's the difference between a good strain of marijuana and a bad strain. The good strain has good entourage phytochemicals, and the bad strains don't. So let's talk about cannabis and dementia. So you've probably heard that in dementia, there's low levels of a neurotransmitter called acetylcholine. And one of the main classes of medications, prescription medications, that they'll give to treat dementia patients is a medication that inhibits the enzyme that breaks down acetylcholine. So let me explain that. If you have a neurotransmitter, let's pretend that this pen, here's the camera. So these two chemicals together make a neurotransmitter. If we cleave it with an enzyme, it's not active anymore. So the body has a system for breaking down neurotransmitters so they'll act and stop acting. You know, when the mailman comes and rings the doorbell, let him ring once and stop ringing. You don't want him ringing the doorbell all day. So there has to be, by analogy, a way to stop the neurotransmitter from acting once it's active. So you break it down enzymatically. Well, there's so little acetylcholine in the brain of people with dementia that the pharmaceutical industry has developed drugs that inhibit the enzyme that breaks down the acetylcholine. So if you inhibit the enzyme that breaks it down, then you have more of the neurotransmitter acting longer. Makes sense, right? So donepezil is one of these drugs. They don't work very well. And in a little bit, I'm going to explain to you one of the mysteries of, I think, my own theory, why they don't work so well. I mean, they could work. They should work in theory, but they don't. Okay, so what's that got to do with cannabis? Cannabis inhibits that enzyme. THC is the best drug known to science for inhibiting that enzyme that breaks down acetylcholine. Who knew? In addition, you've heard about beta amyloid. So beta amyloid, well, amyloid is a protein that's in neurons, and it tends to break down, clump, and aggregate and spill out of the neurons because it's very toxic to the neurons. It starts zapping like with a laser, so to speak, the little dendritic attachments where neurons attach to each other. So pharmaceutical companies are racing for a couple of decades now to find drugs that will inhibit this aggregation of amyloid into beta amyloid. Turns out that the best substance known to science for inhibiting the aggregation of amyloid into beta amyloid is THC. Wow. So this stupid little weed that we're talking about that grows out in the meadows can increase your levels of acetylcholine better than donepezil and can prevent your amyloid from breaking down to these nasty clumps, which are pretty much believed to be causative. So here's the preclinical research showing that THC is the best agent yet discovered for inhibiting acetylcholine esterase, or the brand name for the donepezil is Aricept. How many of you are on Aricept? I guess you can't talk. Jamie, are they on it?
Yep.
For PCA? Yeah.
Raise your hands if anybody is on it. Yeah.
Okay. You probably find it doesn't work very well. In a population study, the Aricept, if this was going to be the natural course of a person's disease, a rapid decline, so the Aricept might slow it down a little bit. This rate of decline from where you are in time, instead of going rapidly down, you're going a little bit slower. But the caregiver doesn't notice this. I mean, you wouldn't know, oh, my loved one would have gone down faster if it weren't for this. It's really hard to discern. It's better than nothing, and it does have side effects. I have seen it work a bit. I'm not knocking it totally. In some of my patients who were put on Aricept by their neurologist, I've seen a signal. I'm pleased to say that, but it's not robust. So THC acts just like Aricept. It inhibits the enzyme that's breaking down your acetylcholine. And THC prevents this aggregation of beta amyloid. Pretty spectacular, right? So what happens in controlled clinical research? They've given marijuana with THC and CBD, all the goodies, to in nursing home settings, and it significantly reduced agitation. Who they gave it to was demented patients with agitation. And you know what that's like. You know, they're frightened, they're hitting people, they want to go home, they don't know the names of their spouses, they're frightened, they're agitated. And the medications that we have for that kind of agitation, like neuroleptics, antipsychotics that we use in psychiatry, those medications kill them faster. So we can't use those medications. So they're really up the creek without a paddle. Marijuana reduces his agitation while also improving appetite. This is funny, but you'll find interesting, the main side effect in that clinical trial, those clinical trials, was euphoria. What's wrong with euphoria? One of the colleagues presenting this information said that America is a euphorophobic country. We don't want our people getting euphoric. Okay, you can do it through alcohol, but not marijuana. If you take somebody who was frightened and agitated and throwing things and hitting the nurses and just not knowing where they are and so terrified, it's a terrified state. I don't have to explain it to you folks. And you make them happy and peaceful and eating. What a blessing. Jamie, there's the links, and there's the links like the journal articles that reference this. You might find it interesting to know there are senior residences in California where cannabis is legal, where they have clubs in which the seniors who join the club and smoke marijuana. Now, they're not allowed to do this indoors because there's no smoking indoors, so they go out to the garden. And these kind of cannabis clubs are very popular, very salutary. People really like it. Anybody can join if they're not. It treats insomnia. I'm not going to bother reading all those details, but THC and CBD are really good for insomnia. For me and for many other people, THC isn't good. It gets my mind too active. But CBD, cannabidiol, is just wonderful for putting people to early, falling asleep early, staying asleep, restful, the restless leg syndrome stops. The authors of the study that combined CBD and THC, 15 milligrams of each, and 15 milligrams of THC is way too much. We're going to talk later about dosing. It improves sleep synergistically. Of the 13 studies profiled in this paper, 7 showed improvements in sleep. Why am I talking about this? Because sleep is so important, and if you have trouble sleeping, your dementia is going to get worse, and probably I think your PCA will get worse. Sleep is essential. So I'm spending some time on this. 6 of the 7 studies were conducted with Sativex, a 1-to-1 ratio of CBD to THC as a sublingual spray, indicating that a balanced cannabinoid profile facilitates sleep improvements among patients with chronic pain. And Jamie, there's the source. So let's talk about pain. Jamie, do a lot of the folks experience pain from arthritis or other conditions that are not necessarily related to the PCA?
I don't know. This is a younger group than would be expected to have arthritis, but you could raise your hand, and if anybody does have pain, definitely sleep problems. There's one pain.
Okay. Well, I'll just go really quickly on pain and won't spend very much time on it at all. This is a double-blind study, randomized controlled study. The top graph is those getting nothing, placebo, or placebo cannabis preparation. The bottom half is, bottom group is those getting cannabis. And this is a very bad strain of marijuana that's available from the government. The government has a little grow facility in Mississippi. It's a government strain. It's terrible. It's not a good one at all. But even that was able to reduce pain. And here's another study showing they're reducing pain by about 25%. Commentary from editorial, while not a panacea, cannabis stands ready at the vanguard of precision pain medicine. An email from a businesswoman, not patient. I had given a talk on medical cannabis, and this lady just sent me spontaneously an email afterwards that her mother has been dealing with chronic pain, lupus, degenerative disc disease, and a form of leukemia, CLL. Because medical marijuana is not legal in her state, my sister, who lives in Colorado, has been buying CBD THC edibles and driving them to her every few months because it really helps her with sleep and pain. I want to talk just briefly about well-being. None of my patients for whom I prescribe the medical cannabis is looking to get high. They actually don't want to get high. They want relief of pain, relief of anxiety, relief of PTSD. They're not looking to get stoned. But they feel so much better that I've had 2 referrals who came to me because the new referrals saw previous patients of mine looking so well, walking around the neighborhood, not in pain anymore, not limping, smiles on their faces. And these neighbors said to my patients, "You look terrific. What are you doing? What makes you look so much better than you used to be?" "Oh, I'm seeing this Dr. Carlton getting medical cannabis." Well-being. It is an adaptogen. Adapt, A-D-A-P-T-O-Gen. That means it helps the body to cope with stress. Your stress responses are much better, much more powerful with adaptogens. Another example of an adaptogen is ginseng. So this is in that class. Now, what about the objections that are raised to marijuana? Isn't it dangerous? Isn't it a gateway drug? Well, you got to know there's a tremendous group of powerful people arrayed against marijuana. They want you to believe that marijuana is dangerous. I mean, it can't be a problem. I mean, people can get addicted to it and get a little crazy if they're way too stoned, but it's not dangerous. A brief word about why they want you to think it's dangerous and a gateway drug. The FDA has been opposed to cannabis for decades. It's a long story, but it favored several industries to ban marijuana, cannabis, back in the 1920s. It favored chemical companies like DuPont that wanted the Navy to buy rope made of nylon, DuPont's nylon, not that stupid fiber from the hemp trees, hemp plants. You see, it was competition. If you could put the hemp business out of business, nylon would sell more, DuPont would make more money. Same for William Randolph Hearst. He didn't want those hemp plants to be made into newspaper. He wanted you to buy his paper from forest tree pulp. So they combined with Harry Anslinger, who just after Prohibition, they had this whole army of men who were breaking stills. Prohibition is over. What are they going to do with this army of men? Let's send them after everybody growing cannabis and jute and hemp. So this whole array of people, the FDA, the industry, they don't like it. So they want you to believe it's poison, gateway drug, get you hooked on drugs. It's actually an off-ramp. In my own practice and widely circulated in the cannabis community, we know that people who are addicted to opiates, when they start taking cannabis, they get off the opiates. Whether it's fentanyl patches, oxycodone, heroin, any opiate, it's so much easier to get off of that stuff. So it's an exit ramp. It's not a gateway into the addiction. It's an exit ramp off of it. Now, CBD, I have many more patients on the cannabidiol than I do on THC because it's such a good anti-inflammatory, anti-anxiety agent. It's so much cheaper than going through the dispensaries to buy the stuff with the THC. So it's legal. An act of Congress in 2015 said that CBD is legal for sale and for shipping in all 50 states as long as 2 criteria are met. Number one, it must be derived from hemp, not marijuana. And number two, it must contain less than 0.3% THC by weight. So it's readily available. You can buy it online, over the counter, no prescription needed. There's certain ethical considerations. It should be organically grown. In this extraction method, no industrial solvents such as hexane. That's a no-no. You don't want hexane getting into your body. Supercritical CO2 is acceptable, not preferred. It's too sedating. My strong preference is for low heat, no pressure as a way of extracting. And my preferred brand is made by Inner Health Helix. They call it hemp extract 250 milligrams per bottle. This is the distributor that I recommend. If the site, cbdoilsoflongisland.com. If the site can't process credit cards that day, call the owner, he'll take a check from you. On checkout on the phone, you can get a discount with the code CB1. Full disclosure, I get a consideration from this discount site, from this website. If you use this code CB1, I get product, and I can then give that product to my patients who are poor or indigent and can't afford it, or at least sell it at cost. In states where medical marijuana has been legalized, there's been a 23% reduction in hospitalizations related to opioid dependence or abuse. Think about that, a 1/4 reduction in hospitalizations, and a 13% reduction in opiate overdose. Read them and weep. There's the answer to that. Oh, it's a gateway. It's not. But there are problems. We have to know the metes and bounds. So THC is absolutely contraindicated in unstable heart disease. If any of you has angina or other cardiac problems causing chest pain, arrhythmias, do not touch this. Don't take a toke. Don't say, oh, I'm just going to have a little toke and relax. You're putting yourself at risk. People actually get heart attacks. If they have unstable cardiac problems and they smoke marijuana, they've gotten fatal heart attacks. The reason is that the THC increases the respiratory oxygen demand of the cardiac tissues. And you'll know this if you've ever taken a brownie, something that, or smoked too much THC. If you get too much, your heart pounds. It's a commotion in the body. It's a physiological stress. So be very gentle in your dosing. And don't take it if you've got unstable heart disease. Problem 2, THC can induce anxiety and even frank psychosis. So it's absolutely contraindicated in patients with schizophrenia, as well as in bipolar patients. But I've had patients go to the dispensaries in New York, and I tell them, you start with a 1-to-1 ratio, 1 part THC to 1 part CBD. It's evenly matched. Start there. Don't go to the 10-to-1, the 20-to-1. I warn them, the 20-to-1 THC to CBD, that's for people with cancer pain. Incredible nausea from HIV therapy or chemotherapy for cancer. Incredibly devastating conditions. Or for people with the kind of life-threatening pain, like a spur sticking into the spinal cord in the neck, and they fall down like hit by a lightning bolt. That kind of pain, 20-to-1. But for the average person to go 20-to-1, it's devastating. So one of my patients wanted to know what it was like to get stoned. She was an Army sergeant who was in a truck accident in the Army. And she grew up in the Bronx, but I never smoked marijuana in the Bronx. She was a straight arrow. So I told her 1-to-1. She went to the dispensary and got a 20-to-1. Her dead relatives were calling her over to the other side. Worst day of her life. Other patients have hallucinated incredible, horrible, frightening visual hallucinations. So if you go to the dispensary, or if you go to a state where it's legal and just go to a store and buy it, don't start with those high doses. And some of these bud tenders, as I call them, they're stoners. So they're used to 20 high ratios of THC. They think nothing of pushing that on you. But let me give you an analogy. If you're at a party and you're having a glass of scotch, you don't pour your glass of scotch into a beer stein. You just have a little sipping glass. You take it slowly. Nobody would drink a beer stein full of scotch. But what a lot of people, especially younger people, are doing with marijuana, they're taking high potency marijuana, incredibly high ratios of THC. They're holding it in for half a minute, so they get a huge dose of it, and really make you psychotic. And the same thing with these brownies. There's a law in Colorado, no more than 10 milligrams of THC in the brownies and the edibles, because it used to be unregulated. And people would take a brownie with 20, 30 milligrams of THC, and they'd jump out the window. You know, literally. There were suicides in Colorado from hotels. College kids coming in, oh, Colorado. So paranoid. And one of the strange things about THC, if you've ever partaken, it slows down the perception of time. So things take forever. You're sitting in a traffic light. Is this like taking 10 minutes, or is it that I'm stoned? It just slows down time. So if you're very stoned and it's a bad experience, it seems to you like it's going to go on forever. It's never going to end. That's why one of the reasons that people get so suicidal. They think it's never going to end. It's a devastating experience. So dose it carefully. Problem 3, THC and even CBD can cause hyperemesis syndrome, vomiting and nausea. It's improved by heat, especially hot showers. These people live in the shower. Provoked by cannabis, eases up with abstention, recurs on partaking again. And I've seen people in the cannabis community say, oh, that's propaganda from the anti-cannabis industry. It's not. This is real. Just really quickly. Young woman comes to me, young mother, 2-year-old daughter, cyclic vomiting all the time, vomiting. Uses cannabis every day. Did before the pregnancy, stopped in the pregnancy, resumed after the pregnancy. This vomiting came on after the pregnancy. In the pregnancy, she gained 80 pounds. She's lost a lot of it. She's thin again. But her physiology changed. She became diabetic during that pregnancy. So her physiology really changed. So I said, do you spend a lot of time in the shower? Oh, she showers all day long. I said, you have hyperemesis syndrome. You have to get off the cannabis. You can't smoke anymore. That was really hard for her. It was her lifestyle. But I've wintered her down, and she's smoking one bong a day instead of like, one bowl a day instead of like 10. So the vomiting's gone. So that's real, folks. There's herb-drug interactions are also possible. I'm not going to take a lot of time on this, but there's a system in the liver called P450 enzymes that metabolize our medications. And unfortunately, CBD and THC interact with those enzymes. So do many other prescription medications. So does grapefruit juice. So does St. John's wort. So this is not the only thing that interacts with those medications, but it does. And therefore, if it inhibits an enzyme that's breaking down the medication, then you can have higher dose of that medication, higher level in your body. You get toxic. If it speeds up that enzyme, you have more of it, then it's going to break down your medication, and you have less levels of it in your body, and you lose efficacy. So you have to let your physicians know that you're starting THC or CBD. You have to. Absolutely must. It's criminal to yourself and unfair to the doctor, because if you don't tell them, they're going to see the medication's not working as well. They're going to give you more of it. Or they're going to see the medication's working too well, and they're going to take you off of it or reduce the dose. They've got to know what you're taking. Every herb, every vitamin, especially this. So don't kid around. Don't think they'll be judgmental. Let them be judgmental, but tell them. Okay, there's ways you can manage the high. This is something I'm very proud to have put this together. Most of this information is from Dr. Ethan Russo, who was with the company that developed Sativex, GW Pharma in England. Very bright doctor. CBD competes with THC for the CB1 receptor. So let me tell you, experienced smokers, partakers, when they need to come down, I'm talking about people who smoke 3 or 4 times a day. That's really part of their lifestyle. Stoners, when they need to come down, they need to take care of the children, they need to go out and drive, they need to go to work. They take CBD. In 20 minutes, they come down. You're just displacing the THC off the receptor. Fresh squeezed lemonade. include a lot of the pulp, which is rich in terpenes. Limonene, which is a terpene from limes. You can buy that as capsules from Amazon. It's a terpene. Pistachios. Why pistachios, people ask? And I don't know, but it's the terpenes. Remember I showed you the entourage slide? So those plant chemicals, and there's a lot of marijuana and hemp are rich in terpenes. It's a chock full of terpenes. Some of the plants have a little bit here, a little bit there. These two plants are loaded with it. That's how come they get names like skunk and blueberry and pineapple, because they really have a fragrance from these terpenes. So there's something called palmitoethanolamide, PEA, which I'm theorizing would also help to get that high down. And worst comes to worst, you can prescribe a benzodiazepine for the anxiety. A lot of people get anxious on cannabis. Dosage guidelines. If a person has had prior experience with THC, they're not naive, 5 milligrams is a reasonable starting dosage. If you're THC naive, a much safer starting dosage would be 1 to 2 milligrams. We call it microdosing. Don't be in a hurry. There's no rush. If you're trying to treat your PCA and you want to start getting THC on board, start low. There's no rush. If you push it, you could have a miserable, horrifying, nightmarish experience, never want to touch it again. And that would be a shame, because this could really help you. This intervenes in the disease process. It's not just palliative, making people feel mellow and euphoric. It's actually intervening in the disease process, because you're slowing down the breakdown of acetylcholine, and you're slowing down the formation of beta amyloid. You're intervening in the disease process. Go slow. So CBD, reasonable starting dose is 5 milligrams. In that product I was telling you about, the Inner Health CBD 250 milligrams, comes with a medicine dropper. And one medicine dropper will give you a 5-6 milligrams. That's a reasonable starting point. Some people have to microdose. I want to tell you the story. Last year I gave a talk to the American Psychiatric Association. A big turnout on medical cannabis in the New York branch. I was really pleased with the turnout. Young woman doctor came up to me before my talk, and she told me that she's been a lifelong migrainer. Nothing ever worked for her. None of the triptans, nothing touched her migraines until she got CBD. I said, how much do you use? She says, 4 drops. I said, you mean 4 droppers full? No, 4 drops. I said, what? 4 drops? Yeah, stops the migraines. I mean, preventive too. And she decided to see if just 2 drops would do it. 2 drops wasn't enough. The migraines came back. Her dose is 4 drops. That's a microdose. Our body is very sensitive. There's something that we call an endocannabinoid deficiency state, EDS. Endocannabinoid means our own endogenous cannabinoid system. We make our own chemicals that occupy these receptors. So we may not make enough of these chemicals. And so you need something from the outside in the form of CBD or THC. So for her, 4 drops, which that's not even a milligram. It's 1/10 of a milligram or something like that. Enough to nourish her endocannabinoid system and stop this devastating disease. Pain every day of her life for years, gone. On the other hand, in refractory pediatric epilepsy, of which I've treated a lot of kids, neurologists will take the dose up to something like 10 milligrams per kilogram. So if it's a 10 milligram kid, that's 100 milligrams of CBD. Big dose. And one child who was on 60 milligrams got vomiting, nausea and vomiting. That was when I knew that CBD can also cause this hyperemesis syndrome. My mind was attuned. It wasn't an accident. Oh, okay. Whatever the reason. There's 3 formulations. There's the vape, the sublingual, and the oral. This is in addition to smoking. If you get buds, or brownies, that's different. But in New York, you can't. So I don't recommend vaping. And even all across the country, vaping is available. The reason I don't recommend the vaping, those little devices with a cartridge, it's got antifreeze in it. Same as the e-cigarettes. Just as with tobacco, to make it volatilize better, they put in this propylene glycol antifreeze. They're heating that to 200 degrees Fahrenheit on the heating element, sucking that in. What's the effect of propylene glycol antifreeze heated to 200 degrees Fahrenheit on the lungs? We don't know. I'm telling you, 20 years from now, they're going to look back and say, look at all the cases of ALS or multiple sclerosis or lung cancer or ovarian cancer that we got from these stupid people smoking this stuff with antifreeze in it. Didn't they think they should test it? What were they thinking? They're not. So I don't let any of my patients vape. Or mucosal, sublingual, that's my preferred route. I tell them it gets across almost as fast. If it's an alcohol tincture, ETOH, if it's an alcohol tincture extract of your hemp, it will get across the buccal membrane very quickly, 4 minutes. The onset of the vape is a minute. If you ever smoked a joint, 90 seconds, you feel it. You feel your first hit. So I wait 4 minutes. What's the big deal? 4 minutes. It's nothing. Oral, I generally don't recommend because it's very slow to onset. That's 2 hours, which is too long. And it's 8 hours to offset. So if it's a bad trip, you're going to be miserable for 8 hours or 6 of those 8 hours of the trip. On the other hand, you can bite off a little piece of the brownie or the gummy. Bite a little piece. Find your dose. And if you use the oral that way, wisely, really thinking it through, going slow, you can find your dose and will give you long-term effects on these neural issues that we were talking about, the acetylcholine esterase enzyme and the beta amyloid. So there might be a place for the slow onset. But the problem, the big problem with the oral is that most people are used to the effect of smoking a joint. 90 seconds, you're high. So they eat the brownie or the gummy, and nothing happens. Remember, it's going to take 2 hours. So they take another piece of the brownie or another brownie. So by the time this comes on, they've got an overdose, and they're out the window, screaming, emergency room, hallucinating, in terror, and there's no talking them down. Just got to wait till this damn stuff gets out of the system. It's no joke. That's why I prefer CBD whenever possible. You don't have to deal with those psychoactive effects of the THC. Almost done with this part of the talk. I have a book coming up, Medical Cannabis, The Promise, the Evidence, and Ways to Manage its Limitations. And I have another set of stuff to talk to you about on the biochemical side of dementia and why coconut oil is helpful to understand the metabolic process. But let's stop now for some questions before we go on.
Thank you. That was terrific. Just raise your hand if you have a question, and I will call on you. And if you're on the phone, you can unmute yourself. And I see a lot of people on the phone. You can unmute yourself and just raise your hand if you have any questions. If not, we're going to go on to coconut oil. No questions. Whoa.
There's one.
Where is it?
Jamie, tell her where the unmute button is. I hear you. You're unmuted, lady. Joanna?
Yes.
Yeah, go ahead.
I'm okay. Can you hear me?
Yes.
It's a bad echo.
Okay. My question was the difference between THC and CBD are like two different things.
That's right.
Like you were talking about the how you take the THC. What about the CBD? Is that administered in all those three?
No. Well, it can be vaped, but I don't recommend vaping it for the same reasons.
Okay.
Sublingual is the way to go.
Oh, it is. Okay.
Yeah.
So it would be the drops. Are they drops?
Yep.
Okay. Okay. And that really is the better thing to do for this.
Well, to start with, but the CBD is not known yet to have those effects on acetylcholine esterase and on beta amyloid that THC is known to have.
Okay.
So if I had a loved one with dementia or PCA, I would start with little bits of THC, advising the neurologist, interacting with the neurologist, because we could have an effect on certain meds. And the neurologist can look that up.
Right.
The P450 interactions.
Okay. Can you do both of them?
Yeah.
Okay, at the same time? Or
Actually, you shouldn't
come together. They can actually, when they make them, they make a very small THC dose with a cannabinol dose.
That's right. A little historical fact. Back in the 60s, the marijuana that was available in the U.S. was from Mexico. It was called Acapulco Gold, and it was 1-to-1. It was the way it grew up in nature, just by evolution. It was pretty much evenly balanced THC to CBD. It gave a wonderful high, and everybody laughed and giggled and had the munchies. It was a lovely experience. The production, the growing started to shift to Colombia, other nations, and they started breeding it, not genetic engineering, just breeding, to have higher and higher ratios of THC to CBD, so 20-to-1, 50-to-1. And they began to call it killer weed. And by the 1980s, the stuff that was available, a friend of mine said, it takes you by the collar and slams you against the wall. And everybody stopped smoking. Who could deal with that? So 1-to-1 is really very gentle.
In a low dose. Anybody else have any questions?
And in those states where there's buds available, the 1-to-1 strains of flowers are ACDC and another one called Harlequin. Those would be some very good 1-to-1, really mild things to start with. Go ahead. Any questions?
I have one question. So, can you hear me? On the
Go ahead.
There were two people talking.
I'm going to take another question. So it says, I don't see your name, but I just unmuted you. Wheels?
Yes. So you're recommending THC and CBD rather than just the CBD oil that's less than 0.3%?
For PCA, yeah.
But CBD is good for pain by itself?
Very good. And for anxiety, insomnia.
Okay, thank you.
Pleasure. Let me go on to the next topic. Word. Let me close down PowerPoint.
You want to just talk about?
No, I'll talk while I'm doing this. Let me close all my windows and I'll get back into it. So in around 2013, the New York Academy of Sciences sent out a flyer in the mail that said they were going to have a presentation called Dementia, Type 3 Diabetes. I said, what? What's type 3 diabetes? What's that got to do with dementia? So I went. And I haven't seen that many cases of dementia over the years. I've seen a few, but I'm a psychiatrist, not a neurologist. So most of those patients are going to go to a neurologist. Let me get... So in this talk, this presentation, let me get a different view here. Okay. They said that in dementia, don't read the stuff that's on the screen there. Just listen to what I'm saying. They said that in dementia, the insulin receptors are damaged in the neurons that have the dementing process, or the neurofibrillary tangles and the plaques. Insulin receptors are damaged. What does that mean? That means that glucose can't get into the neurons. Well, how bad is that? That's devastating. Glucose is the fuel for our neurons. So if glucose can't get in because the insulin receptor isn't working, the insulin receptor controls a gate. So if this is a cell membrane, and here's the insulin receptor sticking up, and over here is a pore that glucose can come in. But the pore is closed. It's a gate. It's closed. When the insulin receptor is hit by insulin, it opens the gate. Glucose can go into the neuron, and the glucose drives the cellular energetics to make all kinds of valuable things, mostly energy, as ATP and NADH and acetylcoenzyme A, which goes to make acetylcholine. All kinds of incredibly important things are dependent on glucose getting in. So that's what all the talks were about. They gave a lot of documentation. So I walked out of there thinking to myself, you got to know, I'm a systems engineer in the way I think. If neurons can't make enough dopamine, give more of the tyrosine amino acid to make more dopamine. That's how I work. Jamie knows this work of mine for 40 years that I've been doing this kind of work to get people better without drugs. I bypass. I'm a systems engineer. So I just learned in Alzheimer's patients, and presumably it's got to be the same thing in patients with PCA, the neurons can't get glucose in. Well, I know the workaround. Give coconut oil. Because coconut oil makes ketone bodies in the liver. It gets converted by the liver to ketone bodies, and ketones are kind of fatty molecule that the brain can use as fuel. The brain is a hybrid engine, like a car that can run on gasoline or biodiesel, from corn, soy oil, those hybrid engines. The brain is a hybrid engine. If it can't use glucose, it can use ketones. This was exceedingly important in the evolution of humans and all animals. And I want to explain to you why, because if you understand this, you really get your hands around this. Starvation is the norm in animal life until the modern era, with farms for humans and refrigerators and freezers and cans and bottles and supermarkets. Until that advent, people starved, especially in the winter. No fruits, no berries. Animals were scarce. They had gone south. They went away. Maybe caught a rabbit. Maybe you could find some nuts that hadn't fallen off the tree yet. You were starving. So you lived off your fat. The fat gets broken down. And what does it get broken down into? Ketone bodies. And those ketone bodies fuel the brain and fuel the heart. So it's an alternative fuel if glucose isn't available because of an insulin defect. So I said to myself, boy, I can't wait till I get another dementia patient. I'm going to put them on coconut oil. And I thought I'd made this wonderful discovery. Wow, I really had grandiose ideas. Well, I'm going to be famous for this. It is a great discovery. It's a great thought process. I'm proud that I thought of it. I wasn't the first, as it turns out. I saw a book by a physician named Mary Newport. And I'm going to show you her husband's work. He had dementia. He was just failing with his dementia. She put him on coconut oil, and he improved tremendously. I'm going to show you his draw clock in a few minutes. Anyway, so before I give you some details about the coconut oil, let me just take you through. Oh, we're running short on time.
Good go.
Well, this is what normally happens. Glucose gets into the cell through the help of the insulin receptor. It's inside the cell, makes small amounts of ATP energy through glycolysis, breaking down glucose. And the glycolysis products make acetyl-CoA, which drives the Krebs cycle, and now you're making a lot more energy. This is an extremely efficient way to capture energy through respiration. If you can't get the glucose into the cell, all that dies. All that stops. And by the way, choline, which is a B vitamin in the diet, will combine with acetyl-CoA, comes through this Krebs cycle, this whole thing here, to make acetylcholine. If you can't make acetylcholine because you don't have acetyl-CoA because of this, what good is Aricept? Aricept is going to salvage the acetylcholine that you've made. If you're not making it, you get nothing to scavenge. That was my inspiration when I was preparing a talk for the Amen Clinic. And this is SPECT scans of an Alzheimer brain. This is a normal brain. Now the SPECT isn't showing, this is showing blood flow. It's not that these regions of the brain are missing, they're physically there, but the blood is not flowing through these gaps, which means that metabolism has stopped. Why has metabolism stopped or slowed down? Because you're not getting glucose into the cells, and cells are dying for various other reasons too. So this is devastating, right? You can imagine. So I ran into a colleague, 2014, 2015, wonderful woman, psychologist, who was married to a brilliant psychiatrist who I'd known 30 years earlier. I said, how's your husband? Oh, he's demented. He's in the nursing home. He's close to death, just discharged from the nursing home. Antibiotic-induced diarrhea. He's in screaming in pain all the time. 3 years earlier, he was running a clinic he had founded, had a stroke, second stroke, third stroke. By the way, he ate meat all the time, charred meat, Venezuelan. Don't eat grilled meat all the time. Eat vegetables and blueberries. It's a whole nother topic. But by the third stroke, he couldn't walk anymore. He couldn't swallow. They had a peg tube in to feed him, everything by the tube. And don't come near him, near his mouth with any food. He's going to scream, ah, because he knows he's going to choke. He's demented, doesn't know his name, doesn't know his wife's name, doesn't know he's from Argentina, doesn't know he's a physician, doesn't know his children or his grandchildren, but he knows he'll choke. Screaming in pain from antibiotic-induced diarrhea because of treatment for his bronchopneumonia in the hospital. So this is a stage it is that I had to make up my own scale. There is no rating scale for this. GEF means Global Assessment of Functioning, but I had to make up my own scale. He was at 100%. Now he's like 4%, 5%. He's a vegetable. I said to him, what is your name? He didn't know his name. But he said, if I knew that, I could get out. So I said to the wife, there's something in there. If I could connect the engine to the drivetrain, I think we could get something. So I put him on coconut oil and 4 of the nutrients. I said, start them one at a time. She started them all at the same time. So this is where he was when I started him, on coconut oil and several other nutrients. I'm not showing you the names of the nutrients. Jamie, I would share them with you, but I don't want people trying these on their own without doctor's supervision or nutritionist supervision. They do have side effects. Anyway, started them. He started eating, and they were ready to do a Heimlich on him to take the food out before he chokes. He swallowed food. He got out of the wheelchair by himself. It was amazing. He learned his wife's name. He learned his own name. Within a few weeks, the wife was able to take him to a restaurant. He could cut food himself, feed himself, took him to shows like at the Radio City Music Hall. He would laugh appropriately, applaud appropriately. He's coming back alive. Before, when they take him shopping, he would just sit in the car. They'd get out the wheelchair. They'd open the door. They'd haul him out, get him into the chair. Now, he's opened the door, trying to get it by himself. Wait. Let's get the wheelchair. Where to go? At one point, he stops taking the coconut oil because he didn't like the taste. And nothing the wife could do to hide the coconut in food. And he could taste it. He wouldn't eat anything that had it in it. He lost a lot of function. You see that drop there? I was wondering the whole time, But wonder what part of this improvement is the coconut oil. Because I had him on 10 different nutrients by this time. One of my other patients found there's refined coconut oil as opposed to the unrefined. So unrefined is theoretically better, it's not processed, but the refined doesn't have as much a coconutty rich taste. So I told the wife of this patient, get him refined coconut oil. He liked it, he didn't even notice it, so he's eating it, bounced back. Right around this time, I found that pantothenic acid, I'll tell you about this one nutrient, is needed to make acetyl-CoA, which is in turn needed to make acetylcholine. Pantothenic acid, a B vitamin, can make people very cranky and cry for no reason at all. That happened to my wife. Makes people irritable. It happens to me. I don't know why it does that, but it does. So it's one of the reasons I'm not showing you all these different nutrients, because they can all have some side effects. Anyway, I put him on pantothenic acid, 50 milligrams, and he just takes off. Many more cognitive improvements than he had before. Says to his wife, please call my brother. Well, which one? Felipe. Okay, well, he's in rehab for a stroke. Do you want to talk to your daughter? Yeah, let me talk about, so it's initiating things. And before I move on, I just want to tell you such a sweet thing. It's his wife's birthday. This is 3 years in. Oh, and at Christmas party, he's standing up, talking to his guests. Walks over by himself to the table, feeds himself. What a transformation from a vegetable in the chair on his way out of this mortal coil, alive. And I got cards from the wife saying, thank you for giving me back my husband. He was still demented. He didn't know that he was born in Argentina. He did not remember that he was a doctor, but he regained continence. He went to the bathroom by himself, and the wife was going behind him and pulled down his diaper. He was still demented, but much better levels of functioning. So this story, he had an aide who was also from South America, and she liked to tease him. So she says to him, why did you get your wife for her birthday? Doesn't respond, very silent, looking sullen. She teases him again, what did you get your wife for her birthday? The aide walks out. The wife says to him, darling, you've given me many things over the course of our life together. Don't worry about it. You didn't remember my birthday. You gave me many things. He said, I gave you love. She said, yes, you did. So that's why I say we can bring people back from oblivion using ketones and a whole bunch of nutrients. Really don't have time for this. Look, avoid chocolate, dairy, wheat, artificial colors and flavors and preservatives, artificial sweeteners, minimize sugars and carbs, avoid fluoride, avoid fried food and red meats. Just try to stay away from those. Don't take supplements with zinc or copper and iron. They aggravate the inflammation in Alzheimer's disease. Zinc and copper do. And iron aggravates the inflammation in Parkinson's disease. Let me take half a minute to talk about this. It's so important. Another topic at the New York Academy of Sciences that I went to see, nutritional metals aggravate Alzheimer's. What? I mean, there are plenty of vitamin formulas like Centrum that have these minerals in them, zinc and copper and iron and all those formulas. So I better go to this lecture. Well, it turns out beta amyloid is very inflammatory. And when it gets out of the neurons into the brain tissue, it creates a tremendous inflammation. That inflammatory response destroys countless other neurons around it, which then spill out their beta amyloid, a chain reaction like the atomic fission reaction. But that inflammatory response does not take place if there's low levels of zinc and copper in animal models. Just add zinc and copper and the brain catches fire with inflammation. And they can see that fire in certain PET scans. Literally, it's red all over the brain. No inflammation if the brain has low levels of zinc and copper, not starvation levels, but you don't want to supplement with zinc and copper. And the same damn thing is true with Parkinson's disease and iron. The alpha-synuclein that spills out in Parkinson's disease is inflammatory, but only if iron is present. if it's iron depleted, not deficient, but if it's not as much iron, you don't get this inflammatory response. Add iron back in at normal levels, the Parkinson animal model brain is on fire. So, but do eat lots of the following foods. A variety of fruits, organic berries especially, a wide variety of vegetables, emphasis on green leafy. Olive oil must be extra virgin. Nuts, especially walnuts. Beans, fish and poultry, some types of probiotics. Avoid diabetes. There's articles you're going to find in, look up Mind Diet, Mesh Diet, and the name Brederson with EN. And you will find these, basically it's the Mediterranean diet. The patients who already have significant cognitive impairment are put on these kinds of diets and some nutrients, and there's tremendous improvements. Not just that you slow down the progression of the disease, they improve, like you saw with my patient. And they've reduced the risk of developing dementia by 50%. And one of the investigators said it was about the equivalent of being 11 years younger in age. So it's never too late to just start eating these protective foods. And there you go. Ready for the next set of questions. Jamie, do you hear me? Jamie? Jamie? Did I lose you? Oh, okay.
This is Paul Cosgrove. And the first thing about CBT and cannabis, one of the slides said that you would repair brain cells.
Yep.
Is that which one is that? Are both of them combined?
Both of them.
Both of them combined.
Yep. Both are neuroreparative.
With PCA, there's atrophy of the brain, where the brain is actually shrunk. Will the brain grow using those?
I don't know,
Okay.
but I know we'll function better. It's a wonderful question. I doubt it will grow back, but whatever's there, you can get the metabolic fires up and running again. Tone down the inflammation, give the coconut oil as fuel, give some vitamins and minerals, some herbs. Jamie, I'll tell you, one of them is like ginkgo. You want to increase circulation. There are herbs that increase circulation in the arteriosclerotic brain.
Thank you.
Sure. I heard somebody talking, but it's like a hearing test. I couldn't even make out what they were saying. I don't hear. I can't hear you. Jamie, if you're there. Jamie, can you hear me? I don't see Jamie on the screen now.
I don't either.
So I think we lost her ability to control. Okay, go ahead with the question though.
Anyway, my sister's been on turmeric for the last 4 years since diagnosis. She had high levels of white blood cells in her spinal taps, like 15, and so we put her on the turmeric, and that greatly dropped down to 2. No raging infection, couldn't have any other symptoms, but
I lost you. I heard you say the turmeric was helpful. That's wonderful. It's anti-inflammatory.
yes, it is. What I'm wondering is that combined with the coconut oil, is there a dosage on the coconut oil so that we can open up the receptors, is kind of what I'm understanding you're saying.
It's bypassing the receptors. It's just a
Bypass.
workaround. There's no receptors for the ketones. They just diffuse into the neurons. So you're bypassing that whole construction site. The dose of coconut oil, thanks, is a half a teaspoon once per day for starters, just for starters. You want to build up slowly as tolerated to 2 tablespoons a day, divided doses. The reason for starting so low is it can produce loose bowels and even diarrhea. And I had one patient just on a half a teaspoon got diarrhea. So you just really have to start low and slow, because you don't want somebody having explosive diarrhea, then they won't touch it again. I can't hear you. Let me call Jamie.
No, I'm back on.
Are you
I'm
back on? Okay. Kathy?
Kathy, can you hear it? Why don't you talk now and we'll see if it works. It's not working. Why don't you type out your question on the text? Are there any other questions? Because I think it's kind of getting late here, and we don't want to. Any other questions? You know, you can always get to me, and I will get to Dr. Carlton. And yes, Dave.
Yes, one real quick question. Did I understand what you were saying? Shirley takes Centrum Silver, and it sounds like you're saying do not take that anymore.
Correct.
Okay.
Yeah, find there are some multivitamins, multiminerals that are zinc-free and copper-free. And one of my colleagues has been petitioning the FDA to take the zinc and copper out of the multis because of this very reason.
Okay.
Great. Well, this was a wonderful, wonderful talk, and we really appreciate it. We're going to make this go live in a bit. I thank you all, and if you want to reach Dr. Carlton, just let me know, and I will get you. Oh, we have somebody who is showing us. Thank you.
You're welcome.
Thank you, everybody. Thank you, Dr. Carlton.
You're welcome, Jamie. I'd love to get some feedback if when people try these various approaches, if they have any experience, please let me know. I wish you all the best.
Thank you so much.
Okay, pleasure. Bye-bye. Bye.